So I want to introduce myself before I show this video. I am Mason. I had a stroke when I was 24, and then after that one stroke, I had bone flap surgery and then had another stroke, which has left me with left side hemiplasia. For the last 6 years, I've been getting Botox injections on my affected side in my arm and in my leg. I would get it every 3 to 4 months, but it just wasn't doing enough anymore. So then I started on the medication baclofen. That also was helping a little bit, but I wasn't noticing that big of a difference. Then moved from Edmonton to Vancouver Island, and a doctor here called Dr. Paul Winston, who has, I don't know if he like invented the treatment or he really, I don't even know what he's done, but he's the only doctor, and don't quote me on this, I'm pretty sure he's the only doctor right now that's able to do this treatment, and it's called cryoneurolysis. What is cryoneurolysis? Cryoneurolysis is a non-surgical procedure in which spasticity or pain is treated through the targeted destruction of one or more nerves. The nerve will regenerate over time. Cryoneurolysis eliminates overactive messages from certain nerves, a factor behind spasticity and pain. Why cryoneurolysis? Compared to other treatments, and I think the other treatments is Botox, is what they're talking about, cryo has been found to last longer. It has surgical-like effects and involves no medication. It addresses pain and spasticity. And it says the cryo procedure. The needle called the cryo probe is inserted under ultrasound and electrostimulation guidance near a targeted nerve. A canister of nitrous oxide in the handheld machine causes the freezing reaction. Using water from inside the body to create an ice ball, the cryoprobe freezes and destroys the targeted nerve, which can then regrow. So these are the frequently asked questions. How long will the procedure take? Depending on the number and type of nerves you're receiving cryo to, the procedure may take anywhere from 45 to 90 minutes. As our clinic is busy and procedures can go over time, plan to spend up to 3 hours in clinic, as waiting times may vary. I know for my time, I think I was there for maybe 2-ish hours by the time that I got there, checked in, did some measurements for my feet and everything. It was about 2 hours. How frequently will I need to have this procedure performed? We have observed that the effects of cryo will last from months to years and can even be permanent. This is the highly variable, however, and depends on the individual, their medical condition, and the areas of the body receiving the cryo. And the last question is, how is cryo different from other treatments? Cryo does not use or inject any medications or toxin. The gas in the probe will not enter your body. Instead, the cryoprobe freezes water from within your own body to create an ice ball that freezes the targeted nerve in order to relieve pain or spasticity. So this is the procedure that I'm going to talk about in this video. It has helped me. You just watch the video. It's March 1st, 2024. I'm currently in Victoria right now because I have an appointment with Dr. Paul Winston to get my cryoneurotomy. I want to take a before and after video of my left side just to kind of see how much change that the cryo does for me. So that's what we're here for. I'm gonna try to do this. This. I'm quite spastic and tight when trying to lift my arm. I try to lift my left arm over my head. I can maybe get it up to like here, and while I'm trying to lift my arm to, above my head, it's very slow because my nerves are fighting so hard to not do that. So that's what the cryo neurotomy is going to do is that it freezes those nerves, so those nerves aren't fighting so hard to stop me from doing certain movements. It's been 2 weeks since I got my cryo injections. I've gone to my PT already, and she even noticed a difference. I was doing movements, and she's like, "You couldn't have done that before." I took a video of what I was like before the injections, and I'll show you what I'm doing now. But the before video, I just showed you of like my arm going up, walking, and honestly that's it, because I didn't know what other movements I would be able to do. After doing my PT and doing exercise and being like, whoa, I can do that. Like, it's so fun learning about your body. I mean, it's obviously very frustrating, very overwhelming as well, but it's exciting getting a procedure done and then seeing the result of the procedure. So I want to show you what, so the one, so let me, okay, so I know that I did like this one and then I did the out one. So this is out like this, like basically even. To my side, pretty high up. I think before I could only like kind of like do this. And when I did that movement, my arm was really stiff. Another thing that I can do and that I need to practice, pull back and then still be able to maintain the strength of the resistant band pulling me back. So just doing, oh my god, my hair looks freaking crazy. Looks like I'm wearing a wig because I have so much hair. Like, look at that. This is all my real hair, by the way. I mean, I did just wash it today, so it's very voluptuous. I could have done that exercise before, but it would have been really hard for my arm to come out, where now my arm can come out like this, and then I can actually pull it back like that. My wrist does kind of, it'll start like this, and then it'll turn in like this, where I'm going to work on leaving my wrist up like that, and that's obviously going to come with muscle strength and everything. Yeah, let me move. I'm really excited. The procedure was pretty uncomfortable, but for these results, and these results will probably last me at least a year or something, right? So it is my duty now to be able to go ahead and go to PT and really strengthen those muscles that I haven't even used in 6 years. This procedure was worth it, and I will for sure be getting it again in the future when it wears off. Okay, another exercise that my PT showed me that I can do to strengthen my leg, because I got injections in my thigh right here, is this exercise. So I'm on all fours, right? I'm gonna start with my right side. So I'm on all fours, and then I just go like this. And you can't really see, but my elbows are slightly bent, so I can really work on my shoulder. And then I'm gonna use my left leg. And before, I wouldn't have been able to do this exercise at all. But now, with my cryo, like, look at that. It's crazy that I can, like, that doesn't even look like my affected leg. And the fact that I can bring my knee in and bend my knee, I wouldn't be able to get into this position. But now with my, like before, I would have been maybe like this. So now that the fact that I can go like this, like look how straight my leg is. Like that's crazy. And then go like this. Like that's absolutely wild to me. Okay, it's low here because I want to show you what my elbow strength is like, and shoulder strength is going to be like. Tabletop, I do have to get my thumb out so it's out of my hand like this. Put my hands down like this. And this is another exercise that's good for my shoulder strength. So I bend my elbows a little bit and then I lift up. So I'm putting all my weight on this shoulder to kind of strengthen, just kind of say, hey, we're going to work now, right? So all in all, yes, it was a very uncomfortable experience, but Dr. Winston at Victoria General is so supportive and just so knowledgeable. Is that a word? Yeah, knowledgeable on this topic. I am going to be forever grateful for Dr. Winston. And it was actually my PT here in Courtney that suggested the cryoneurotomy. So I am super thankful for my PT, Juliet at Solid Ground in Courtney. I'm so happy with the results. At night now, I do have to wear a brace on my hand that like holds my hand kind of like at this, but I'm fine with that. Thank you, Dr. Paul Winston. I love you. So, see you at my follow-up. So I'm just in my basement and my husband has, his stuff set up. Oh my God, he's such a huge Saints fan, and all his workout stuff, kind of storage. And then there's just like a giant picture of me because that's when I did a show on for the brain care center in Edmonton, and I got to keep my poster. So, but like, how banging I look. Another movement that I've noticed that I can do now with the cryo is laying on my back and having my arm be able to go up. And where before, I think I would maybe be able to bring it up a little bit, and then obviously with help and support from someone, they can kind of guide my hand or my whole arm at 90 degrees, where now I can lift it up and then I can put it down. And I can bend my arm to touch my nose. And then another PT that I remember, or OT, is having my arm straight up and kind of punching the air. And another exercise my PT said was to spell my name in the air. So I'll show you. So like this, and then down. So you can see my arm is kind of closing down a little bit. That's just because I'm getting tired and I don't have the muscles there. So, and I'm quite spastic right now, or I'm quite tight right now because I am filming and I feel like I have to like perform for you guys. With PT and strength training, I'll be able to do that a little bit more. And it's really important to do my PT and my OT right now while the cryo is at its highest, so that maybe I won't need a bigger dose next time. I don't know how it works. So, but like I said, this is all worth it, and now I just need to do the homework and work extra hard at OT and PT. Hey, buddy.